Today's subject is health education and community pharmacy. You have to see the chapter number 1, that is concept of health, and you have to see the subtopic is natural history of disease. In this you have to see the processes that is called as pathogenesis. The process is called as pathogenesis. The pathogenesis means what? The pathogenesis is a process of biological mechanism which leads to the disease condition. This pathogenic process is described about the occurrence of the disease, that is acute, chronic or recurrent conditions of the disease. This is called as pathogenesis. So this phase means this pathogenesis phase begins with the entry of disease agent into the man, that is host. Means in this condition of pathogenesis, the phase begins with the entry of, this is important, that is entry of the disease agent into the man. It is called as the host. Then what is the difference between pre-pathogenesis and pathogenesis? The pathogenesis means the before entry of disease agent into the man, means before, it is in the anaerobic process. But in pathogenesis process, this phase begins with the entry of disease agent into the man, that is called as host. Means it is the process in human beings, that is called as the pathogenesis process. So there is certain intervals of time before onset of clinical signs and symptoms of the disease. This process is called as incubation period. Then first we have to see what is incubation period. The incubation period means the period in between infection of germs and appearance of the symptoms or illness of disease condition. This condition is called as incubation period. Means in this there is a certain interval of time that is called as before the onset of clinical signs and symptoms of the disease. This period is called as incubation period. Means in this during period the disease agent multiplies and induces the tissue and physiological changes. Means these conditions occurs before onset of clinical signs and symptoms. Means during this incubation period, the disease agent which is entered into the human beings or man multiplies and induces, means increases the tissue or physiological changes in the human body. The incubation period is followed by early pre-pathogenesis. Because early means the disease agent is entered into the man. In incubation period, he has not seen the sign and symptoms. But after some time of incubation period, it is followed by early pre-pathogenesis. Means during this period, simply it is called as the sign and symptoms are not clear. Means during this pre-pathogenesis process. Means this is all about the incubation period. Means incubation period only disease agents multiplies and induces the tissue and physiological changes. And during this incubation period, the sign and symptoms are not clear. Then it is called as pre-pathogenesis. Then this is followed by late pre-pathogenesis, when there are clear-cut sign and symptoms seen. After the pre-pathogenesis process, means this is called as the pathogenesis process. After incubation of some time, when there is clear-cut signs and symptoms occurs. The final outcome of disease may be recovery, disability or death. After seeing the signs and symptoms, the final outcome of disease may be, the first is recovery, means totally cure the disease condition, or disability means dysfunctioning of the anatomy and physiological functions, or in this chronic condition it will lead to the death. Means it's the final outcome of the disease, that is the first is recovery, second is disability and third or death. Then we have to see the importance of natural history. Each disease has its own natural history, but it is not necessarily the same occurs in all individuals. Means the disease agents or signs and symptoms are different in all individuals, but it is not necessarily the same in all individuals. If the phase of natural history is known, means the disease condition is and their signs and symptoms are clear, then it is identified, then appropriate level of prevention can be applied. Means prevention measures can be taken place to cure the disease identified and to cure the disease condition, to prevent or to cure the disease condition, and the appropriate level of preventive measures can be applied to cure the disease condition. Then next we have to see what is the disease agents. The first link in the chain of disease transmission is the disease agent. This is the first link of the chain of the disease. The transmission is the disease agent in the human body. The disease agent is defined as living or non-living substance. This is either living substance or either non-living substance, or the excessive presence or absence of force which may be initiate or perpetuate a disease process. Initiate means start, to start the disease process, and the positive agent is called as disease agent, which initiates means which start the disease process. It is called as disease agent. Then the disease agents may be broadly classified as, the first is biological agents, second is nutrient agents, the third is physical agents, then fourth is chemical agents, fifth is mechanical agents, sixth is social agents, and seventh is absence or excess of health factors. So these are all disease agents and their classification. Then in this lecture we have to see the first process is called as pathogenesis. Then second we have to see the importance of natural history. And last we have to see the next topic is, this subtopic is disease agent and their classification.